Hi, good afternoon. I'm Dr. Amit. I'm director founder of Divine Cosmetic Surgery. I'm a plastic surgeon based out of Delhi. Now, over the last 1 month, with interaction with peers, many seniors, and a few international doctors, I have created a flowchart of how we are going to be managing the safety of our personnel and the sterilization of our center in Delhi. And over these two parts, I'm going to discuss over this infographic how we're going to be managing the cleanliness, the OPD, and the operation theater sanitation as well as protection. So, if we look here, the first is the protocol for the clinic and staff protection. So, at the center, the first thing, the cleanliness has to be done in the early morning before the staff comes in. Floor, doors, tables, sofas, all artifacts, handles, shoe racks, inside the cupboards, toilet, any area of contact where a hand can be touched will be sterilized in a way I'm going to talk about. Roof and walls which are not in touch in close range need not be cleaned by the spray of this particular product. Of course, if fumigation is being done, that will usually take care of that. So once a week of fumigation is usually enough for that. Now, the cleaning staff has to wear non-laminated thin GS 45 GSM to 50 GSM overall. The shoes may be covered with shoe cover. A cap and a normal two-ply mask is good enough. It's just to protect from the fumes. Then he will be using an automated sprayer. Now, the technology that I'm going to be talking about is going to be very, very cost effective. Of course, there are much more expensive variants of it, but this is one of the cheapest ways we can manage. So, these fogging machines, they come in capacities of 10 to 16 liters, cost anything from 2800 to 4000 rupees plus GST. These I will be using silver nitrate hydrogen peroxide mixture, which comes in 5 liters of solution. And now there are a lot of people who talk about sodium hypochlorite. The problem with that is it tends to discolor sofas and fabrics. It's also said to be a little unsafe for the human skin. Now, silver nitrate hydrogen peroxide mixture is a little more safe. Of course, it should not fall directly onto the eyes, and it does not discolor any fabric. So the fabric longevity will not be a problem. So only 10 ml is required for each liter of water. The cost is 1500 to 2000 rupees per container. Therefore, the we can make almost so from 10 ml. If you're going to be making 1 liter on an average, one application will be about 10 liters of water. Therefore, easily we can get about 50 such cleanings, and the cost is only about 4 or 5 rupees per session. Once the spray has been done, we wait for 10 minutes, and then mopping with warm water or even dry cloth is good enough. Say, for example, over the door handles and tables. Now, the spray has to be done all over, including the computer displays as well as the telephone devices, the stationary telephone devices. And I will be repeating that in the evening. I don't have UV lamps, but if UV lamps are there in the operating room, they can definitely be used overnight. Once every patient comes in and goes, the areas where the patient has been in contact, door handles or everything, will need to be sprayed with the same solution every time and gently cleaned with a dry cloth. No regular spray is required all over the center, so only over the specific areas. Of course, we will be keeping all the doors open as much as is possible. For the teams, first we go to the admin team, say for example the reception or the finance people. If they are in the facility, if they're not in the facility, they don't need much protection. Just a normal three-ply mask is good enough for them. But for person at the reception and any person who's handling the patients, first of all, every entry will have a foot controlled sterilizing device. So that will be mandatory for everyone. Temperature checks, of course, so the prerequisites have to be clear that the patient does not have any other problems. So we're going to be talking about that later. But the admin team will be wearing a visor, a three ply or a KN95 mask. An N95 is not really required. It's a little expensive as well for daily use, but a three ply is very cheap, so that can be easily used. Patient, the receptionist or the admin team need not wear gloves all the time. They're not required. In fact, use of gloves is said to even spread the problem. So we're going to be using gloves, disposable gloves, which are very cheap, only when there's contact with the with any person. So for example, person comes in and there's any transmission of paper or anything in so even when the receptionist has to come in contact with the patient, so they will dispose of those gloves and wear a new pair of gloves when any other patient comes in. And anytime when there is no one in the clinic, there will be no gloves. We are absolutely banning any beverages in the center. So any tea or any water has to be brought by the staff themselves. No sharing. No, we will not be doing any utensil cleaning in the center at all. And mobile phones will be kept mandatorily in a plastic container in the bag, and only the office landlines will be used. So no outside contamination is accepted. For the HT team, for the hair transplant team, or any team concerned with the local anesthesia procedures, no food and water again, mobile, same rules. All clothes, as soon as they come in, any jackets or something need to be taken off, and over their existing clothes, what they can do is just mandatorily wear these OT laminated or non-laminated wear. If they're going to be in touch with body fluids, then laminated is mandatory. We do not recommend PPE for this because it's really uncomfortable, and honestly, it is not required. So non-laminated ones can go on for the HT team who are not in touch with any body fluids. Gloves, sterile gloves, the and cap. So they're going to be wearing N95 masks in the operating rooms, local anesthesia, as well as any of the hair transplant procedures. Now N95s, they're going to be giving 3 sets to the patient. So they wear on day one, keep it in a plastic container, leave it to dry, and not in direct sunlight. And then next day they wear the second, next day they wear the third, and the fourth day they wear the first one. So they will be given the masks. The clinic will be providing them free of cost. For the they'll also be wearing visors all the time. And as soon as the surgery is over, they will be asked to leave immediately, while disposing the all the gowns and caps and masks in a disposable bag. So friends, that is the way we're going to be controlling this environment. In my next video, I'm going to talk about how we are going to be managing the OPD as well as the operation.